Hello. On behalf of the South Dakota Department of Health and the Cardiovascular Collaborative, I'd like to welcome you all to the third webinar in our Community Health Worker series. If you were with us on our last webinar, welcome back. If you are just tuning in, we are happy to have you join us here today. And to get us all up to speed, I want to share some background information on how the CHW webinar series came about. In January of 2016, about 24 healthcare professionals began developing a strategic plan for statewide cardiovascular health. It was finalized and implemented in 2017, and the current version of this plan is what you see. It can also be found on the South Dakota Department of Health's website listed at the bottom of your screen. During the process of developing the strategic plan, there were 4 different goal areas identified as denoted by the different colored columns you see here. Each of the goal areas has a work group working toward the area's designated strategies. The Priority Populations Goal Area Work Group, denoted in green, has prioritized focus in recent years on maximizing community clinical linkages, such as the community health worker profession. As a result, the Priority Populations Group decided to develop this webinar series, provide additional training for South Dakota's healthcare professionals and organizations related to the community health worker. To learn more about what the South Dakota Department of Health is doing on community health workers, we encourage you to visit the community health workers page on the DOH website. Here you can find a compilation of resources to assist with the awareness and promotion of CHWs here in our state. As I mentioned earlier, this is the 3rd installment of the CHW webinar series. The first webinar, archived on the DOH website, was hosted last year and focused on community health workers, who they are, and what they can do for you. The second installment of the CHW webinar series took place this past January and focused on the South Dakota Medicaid Reimbursement services. We also would like to encourage you to download and use the Community Health Worker Reference Guide, which is a handy guide providing an overview of CHWs and which actually features a case study from the Bridging Health and Home program at Sanford Health and Webster, which is one of our speakers for today's presentation. Now, I am happy to introduce our first speaker for today's webinar, Carly Swanson. Carly is a clinical learning and development specialist at Sanford Webster Medical Center, where she provides support for evidence-based health promotion programming. Previously, as program manager for the Bridging Health and Home program, Carly oversaw day-to-day management and implementation of a successful, innovative nurse-led pilot program aimed at improving the ability of older adults to age in place. Her experience working on innovative teams allowed her to develop a unique inter- and intra-professional viewpoint. After completing a bachelor's degree in nuclear medicine technology, Carly's research career assisting in the development of molecular breast imaging technology led her to seek a degree in nursing, nurturing her desire to improve the health of others. She has held positions in both large inpatient units and critical access hospitals. Carly has a passion for improving and enhancing care delivery by fostering community relationships and supporting the voice of those whom we work with and for in healthcare. Thank you for presenting today, Carly.
Thank you, Larissa. I am excited to be here with you all today and talk a little bit about the program that we were able to implement in Webster, South Dakota. I'm just waiting for it to have control of the slides. All right, perfect. So for those of you who are not familiar with Webster, South Dakota, it is located in northeastern South Dakota in Day County. And in 2017, we were able to have the opportunity to receive a grant that allowed us to focus on developing a model of care that would help older adults age in place with dignity and vitality. And we were with a specific focus on aging in place and wellness. And Dade County was a great place for us to be able to implement this program because a large proportion of the population are older adults. It is a very rural location with most of the major cities around it being at least an hour away, as well as other medical facilities. And we know that our rural older adults often struggle with issues with social isolation as well as accessing needed resources and healthcare services. So to develop our model of care, we really leaned on the quadruple aim. And the quadruple aim really allowed us to focus on aspects of care that promote positive experience with our patients, improve health outcomes, and decrease the cost of care, while also leaving our healthcare teams feel satisfied and find joy in the work that we're doing. We really know that ultimately pulling in that piece of team satisfaction will improve our patient outcomes, because if we have teams that are satisfied doing the work that they love, it's going to reflect in how our patients are feeling about the care that they're receiving, as well as their ability to achieve their own personal health outcomes. So when using the quadruple aim, what we really came up with was a model of care that bridged the gap between the local healthcare system and the community. And we used principles of faith, community, and nursing, as well as foundations and the program of Better Choices, Better Health to help support our work. We titled our program Bridging Health and Home because of that connection. And at the core of our model, we really have a nurse-led clinic and a CHW. And what our core team does is support patients, community dwelling participants that are struggling with or need assistance with chronic disease management. We know that is a huge issue in the demographic that we're trying to serve, which is older adults, as well as allowing them to access the resources they need to maintain a healthy life. And that core team is supported by a group of interprofessionals that consist of local healthcare providers. So for Webster, this includes a physical therapist, occupational therapist, social work, pharmacist, a provider, and an integrated health therapist. So this interprofessional team really allows our RN and CHW to ensure that they're providing holistic care to our patients by bringing those hard cases back to that interprofessional team and giving them an opportunity to shine some light from their own unique viewpoints on aspects of their care that we might have missed from our individual professional lenses. And one thing I would also really like to lift up about this model of care is that we used a community advisory council to help gain trust and guidance on what the community needed from us. So without that community buy-in and trust, it would have been very hard for us to implement this community health worker and nurse into the community. So as I go through a little bit of what we worked on to get this program up and going in Webster, I'm going to talk a little bit more about how that trust was really critical in developing a successful model and how our community is really important. So what does this model of care really look like in practice? What we have is weekly we send our community health worker and nurse out to a community storefront, and where we go is actually the Arts Council building on Main Street in Webster. And there we welcome older adults to walk in or schedule an appointment to visit with the nurse or the community health worker. And the first time an individual comes to see us, we do what we call a health risk assessment. And that health risk assessment is done by the nurse and helps us identify the risks the individual has for achieving or maintaining their wellness as they age. And based on these assessments, our team is best able to implement or assist the individual in accessing resources, education, or developing a care plan to help them meet their individual goals. And this is really where our CHW becomes a critical member of our team. We know that many older adults have chronic conditions, and the biggest barrier to achieving optimal health for some of those chronic conditions is how social determinants play a part in those. And so when we were deciding on our model of care, pulling in that social determinant piece was really critical. So we recognize our community health workers' ability to impact cost of care, to impact health outcomes and patient experience, as well as elevating the scope of practice for our licensed team members to improve team satisfaction. But their unique focus on social determinants of health really places them in a position on the healthcare team to increase our ability to address the factors that impact or influence the health of individuals and communities. So when we look at this model of factors influencing health, you can see that just clinical care alone only contributes to 20% of the factors influencing someone's health. And when we add that community health worker into this model, they're there to help support our nursing staff and our interprofessional team in addressing those social and economic factors. They can even assist with physical environment when there's housing issues, or maybe they recognize needs in the community for green space or violence that's making the physical environment impact health. And then they can also, in our model, our community health worker also assists with health behaviors by addressing and supporting individuals in their goal setting and building that confidence in maintaining or self-managing their chronic conditions. So one story I really like to share about this is when we were early on in our work, we had an individual present to our bridging center, and she was really considered a high utilizer of the clinic and was deemed non-compliant, a word we don't usually like to use, with her medications. So our team really sat down with this person, got into a really good discussion, and asked them, what is your biggest concern? And her response was finances. She couldn't afford the medications to help control her COPD and her diabetes. If you're not familiar with inhalers, they're incredibly expensive. So we really gave this issue to our community health worker, and our community health worker was able to assist this individual in applying for Medicaid, applying for loan forgiveness for some outstanding student loans this person still had well into their 60s. And guess what? With just a couple hours of work, our community health worker was able to assist this person in relieving the economic factors contributing to her health, which has significantly reduced her visits to the healthcare system because she's able now to afford her medications. She's able to be compliant with the clinical recommendations. And it really has reduced her frustration with the healthcare team, and vice versa. So as you can see, this is really a good example of how those economic factors can contribute to health behaviors, and a way that we can incorporate that community health worker role into our model of care to address some of those factors that we're not traditionally addressing in healthcare. So there are a lot of models of care for community health workers, and it's not a one size fits all. It truly needs to be based on your individual community needs. So which model you choose is really going to be dependent on the population you're serving and the goals of your program. So with our program, we were based out of the Sanford Webster Medical Center and really wanted our our CHW to be a member of the care delivery team. We wanted to improve the chronic disease management within this population to help them age better and live better. And we also wanted our CHW to be able to bring the community needs back to our team. And so we incorporated that community organizer and capacity builder there at the bottom to our model of care as well. And I think that's really important to lift up that individualizing your position is going to be really important when you think about structuring how your CHWs serve your community. So what does our CHW do on a day-to-day basis? She really has three buckets, big buckets of work. And the first one is volunteer management. We know or had experienced in the early days of our work that social isolation was a big piece of the well-being and wellness of our older adults. And so we were able to implement a couple of programs to help address that social isolation, and our community health worker has really been the connection between satisfying that resource and the individuals who need it. And then chronic disease self-management probably is the biggest bucket of work. And in that chronic disease self-management, our CHW is facilitating and organizing Better Choices, Better Health workshops. We really feel this content is beneficial to all our participants and encourage it for development of self-management skills, but also for the social aspect. Understanding that other individuals are going through the same struggles that you are going through really helps provide that confidence that our older adults need, and also some communication tips to help them in managing their their chronic conditions themselves. She also supports some support groups, and that's really important in assisting our caregivers and also those grieving as we deal with a lot of changes in older adults with end of life, dementia, and caring for those people. And that was a really big need that she lifted up in the community that we were able to address and help support that self-management. And then the biggest bucket of work is the individual support and goal setting in that chronic disease self-management. And I really want to emphasize that our CHW assists our RN in reinforcing content that the RN has educated our participants on. The register nurse works really hard with them to get them on track, make sure their medications are in line, they have the resources they need, and then our CHW is able to support them. And how do we continue to set these goals, continue to move forward, and then reinforcing the education that the nurse has provided. And then the last but not least important part of our community health workers' role is that community outreach. Our hypertension is one of the most prevalent chronic conditions for our age group. And so blood pressure screenings and checks have really become an important piece of this individual's work, because we can screen a lot of people and catch a lot of things before they become bigger issues. I really like to lift up a good story. We have a gentleman who religiously comes to the Bridging Center to visit our community health worker and get his blood pressure checked and also get a hug. And one day he came in and his blood pressure was significantly lower than it typically had been. And he had some complaints of dizziness. So our community health worker was able to pull the nurse in. And that eventually led to pulling the pharmacist in. And we were able to discover that this person had been prescribed the same blood pressure medication by two different providers and was doubling up on his prescriptions, which is a really good example of how being in the community and being accessible allows us to catch some of these issues on the excuse me, on the front end before they become problems. And this man was ever so grateful that we were able to make a simple solution to help him feel better. And then the last piece is really that health promotion and community capacity building. Our CHW is constantly in contact with community leaders, our patient and family advisory council, and community members in identifying and communicating the needs of our older adults, and that advocacy is priceless. With this role, some of our key competencies, I'd say one of our biggest key competencies that we really wanted our community health worker to have on top of that core education is motivational interviewing. And that's really a way of being with someone and working alongside them to discover how they can find the motivation to make the changes versus directing what they need to do. Mental health first aid was another really big piece of that education for our CHW. Obviously, the better choice is better health, and we use a lot of those concepts in the CHW's scope of practice for educating. Personal safety was big, as well as having basic life support certification. As our CHW does sometimes visit people in the community in their own homes outside of the healthcare system. And then again, being competent and trained in that blood pressure management or manual blood pressure. And last but not least, the other piece that really was most important and one of our key learning was choosing the right individual for the CHW role. And to do this, we really used a unique hiring process. We were able to pull in 3 different approaches to hiring or interviewing our individual. And we used a combination of behavioral interviewing, a case study, and a written assignment. And through these 3 pieces, we were able to identify proficiency in communication, which would be particularly important if you're looking at a multilingual individual, as well as their critical thinking skills. So what are their instincts for helping others? What would they do if their first assignment was Sally, who was new to the community, had no social support, just had a newborn baby, and lost her job? We really focused on identifying those natural helpers and not so much on what their previous work experience was. We wanted them to have a life experience and knowledge to help individuals access resources when they're struggling. And that life experience is really important, as well as being trusted members of the community. That trust is critical because if I were to walk up to you on the street and say, hey, I know the perfect thing for you, you should go see that community health worker, or you should go to Bridging Health and Home. The first thought in your head, maybe not the first thing that you said, but the first thought in your head would probably not be sure. But if your mom or your neighbor or your pastor said, hey, you should go check this out because I think it'd be good for you, you're much more likely to do that. And so having a trusted member of your community was, for us, was really beneficial in getting that buy-in and people to use our programming. And I think one of the biggest factors contributing to the success of our outcomes. So our health-related quality of life indicators really improved for the individuals participating in our program at 6 months. And I think when we look at the impact of this model, the important improvements we're seeing in social satisfaction and quality of life really point to the social determinants of health interventions provided by the CHW. Additionally, when we look at how we're impacting our quadruple aim, we're really seeing improvements in all 4 components. Our RN and CHW team with interdisciplinary support are decreasing the overall average hospitalization costs of our participants, which just points to the better control we're seeing in our chronic disease management, in our health outcomes, and our patients are very satisfied with their care. They appreciate the extra time and to communicate their needs and the extra attention that they're receiving from our team in the community. And our team's satisfied. They have more autonomy in their practice and they're able to provide their unique viewpoints, which is really important. So overall, we really have felt this model has been beneficial to our program, and we will be continuing it past our grant funding. So that's really exciting, and thank you all for your time.
All right, thank you, Carly, for your outstanding presentation. Now I'm happy to introduce our second and final speaker for today's webinar, Megan Jacobson. Megan is an SDSU Extension Nutrition Field Specialist at Mitchell Regional Center and serves as the Better Choices, Better Health South Dakota Program Associate. Since 2014, Megan has facilitated the BCBH South Dakota workshops and trainings as a certified chronic disease self-management program master trainer and lay leader. Through collaboration with a variety of local, state, and national partners, she works to integrate evidence-based programs like BCBH to help manage and prevent chronic disease.
Thank you, Larissa, and good afternoon, everyone. I'm pleased to have the opportunity today to present on the development of a Better Choices, Better Health South Dakota community health worker model from the perspective of a university extension system. I'll also share some opportunities for partnership and expansion of this model in our state. So to kick off my presentation today, I would like to get a sense of how familiar you all are with Better Choices, Better Health South Dakota. So while I'm sharing a brief background on the program, please take a minute to answer the polling question. And Chantrice, if you could let me know when that, oh, there we go, I see it. So I'll continue on as you guys read that question and take a minute to submit your answer. So Better Choices, Better Health South Dakota is a community-based, peer-led suite of chronic disease self-management education workshops. They were originally developed by Stanford University and are now held within the Self-Management Resource Center. The program in South Dakota, the license for that is a statewide license, and it's held by SDSU Extension. And the program is coordinated in partnership with the South Dakota Department of Health and the Department of Human Services. Chronic disease self-management programs have over 30 years of published evidence-based research showing the improvement in the health and the quality of life of people living with chronic conditions. The program has also been shown to reduce healthcare costs through a decrease in emergency room visits and length of hospitalization among participants. And as Carly shared, all of the wonderful outcomes that can also happen in the community and with your patients in the clinic. Locally in South Dakota, we have collected participant outcome data at pre-post workshop and 6 and 12-month follow-up. And we were pleased to find results that were comparable to the national outcome studies, with significant improvement in participant self-efficacy. Our partners with the South Dakota Foundation for Medical Care Quality Innovation Network also conducted a separate study specifically with our Better Choices, Better Health Diabetes program. They looked at both participant outcomes and clinical data, and they found improvement in self-reported exercise, feet checks, and self-efficacy, along with improved clinical measures of hemoglobin A1C, HDL, LDL, total cholesterol, triglycerides, and blood pressure among the participants that they surveyed. To reach South Dakotans with the Better Choices, Better Health program, SDSU Extension offers lay leader trainings for volunteers and for those sponsored by their organization who are looking to implement the program in their community. Currently, Better Choices, Better Health offers workshops for chronic disease, chronic pain, diabetes, and most recently added cancer. Better Choices, Better Health tracks and manages all referrals, data, leaders, trainings, and implementation sites and host organizations through a software called Workshop Wizard. This allows the program to centrally coordinate statewide programming and generate reports for our local partners and our national funders. Okay, so in looking at the results of the poll, you could pull that up. Okay, wonderful. So in looking at the poll, I'm happy to see that some of you joining us today have been involved with Better Choices, Better Health in some capacity. If you're interested in learning more about the program, I really encourage you to visit our website, betterchoicesbetterhealthsd.org, and we share a lot more information on the website, and that is also where you'll be able to find information about any upcoming trainings or workshops. Okay. Okay, so now I'm going to share with you the concept for our Better Choices, Better Health South Dakota CHW model that was developed within SDSU Extension. A critical component to establishing the Better Choices, Better Health CHW position was the ability to embed the position in rural, tribal, and medically underserved population areas to increase the reach and access of the Better Choices, Better Health suite of programs. The model incorporates SDSU Extension nutrition assistant paraprofessionals. These positions are located currently across the state in rural, primarily tribal communities, and are hired based on the same core competencies identified as necessary for CHWs. It was imperative that these individuals already be working in the community and have been reaching across divides to bring programming to the communities that they serve. So we created a hybrid position with shared roles across CHW and nutrition assistant services. Thus, these positions serve as conduits to provide Better Choices, Better Health system navigation, resource coordination, coaching, social support, and culturally appropriate health education and information to the individuals in the communities that they serve. Okay, oops. Okay, there we go. So here on this slide is a table that lists the certification trainings that the Better Choices, Better Health community health workers complete as part of orientation. At completion, they have gone through the Community Health Representative Online Basic Training and are certified to teach the Better Choices, Better Health suite of programs, Walk with Ease, Fit and Strong, and Nutrition Assistant programming. Also, as a prerequisite for the Walk with Ease program, they also obtain their CPR certification. And not listed on this table, but also something that the CHWs are trained in, is mental health first aid. And while this model is new and still in pilot phase, we will continue to adopt best practices and take our lead from the South Dakota Department of Health CHW work group as they lay out recommendations for scope of practice, core competencies, and education and training. Okay, the next polling question I have for you is in regards to South Dakota Medicaid reimbursement for CHWs. So take a second to answer that question as I continue with this slide. So for the expansion and sustainability of the Better Choices, Better Health CHW model, We are looking to contract with health systems on a shared CHW position. We feel this partnership will help leverage capacity and create cost savings and increase referrals and coordination of patient services between the community and the healthcare setting. And I hope that most of you had a chance to submit your poll questions. I will take a minute to look at the results. Okay, Chantrice, if you could pull that up. I'm not seeing anything yet. Okay, wonderful. So the majority of you answered no, and the polling question was, does your organization plan to hire community health workers and submit for that reimbursement through South Dakota Medicaid? For those of you who answered yes, however, South Dakota Medicaid has recently approved the Better Choices, Better Health curriculum as a CHW training program. Therefore, if you are a Medicaid provider who partners with Better Choices, Better Health on a shared CHW position, or if you are interested and send staff to lay leader training, you will have the opportunity then to submit for reimbursement for Better Choices, Better Health services provided. Okay, and the last polling question I have is asking your interest in contracting for a shared Better Choices, Better Health CHW position after the information that was shared. So take a minute for that, and I will check in on the results before I end today. So before I do end, I would like to introduce you to the 2 Better Choices, Better Health CHW positions that we currently have hired within SDSU Extension. Lindsay Silty is located in Brookings, and she has a focus on serving the farm and ag population to provide outreach and coordination for chronic pain management and mental health services. And Julian Witt is located in Sioux Falls. Julian was born in Aberdeen, South Dakota, but resided in Germany for a number of years up until last year. He is fluent in Spanish and German and will be providing outreach to Hutterite and Spanish-speaking populations. Julian will be attending training to teach the Tomando Control de su Salud, which is the Spanish version, or the Spanish chronic disease self-management program. Both Lindsay and Julian attended the Better Choices, Better Health lay leader training in Sioux Falls last November 2019 and had plans to co-lead their first workshop this spring. Unfortunately, that has been postponed due to COVID-19, but they are assisting with the virtual delivery of Better Choices, Better Health programming and will be leading nutrition assistant programs online. As Carly mentioned in her presentation, their CHW was really involved in outreach to help those in situations of isolation. And so we're fortunate to have our CHWs during this time be able to also make phone contact for those who may be in an isolated situation with multiple chronic conditions and need the support. Okay, so if I could get the results of the poll. Okay, wonderful. So we have a mix. And if you are interested, I will go to the next slide. I would love to have you contact me. Here's my, oops, I went too far. My contact information. And then also, as I said, we do have a website for Better Choices, Better Health South Dakota, where there is a contact us section if you have any questions as well. So thank you very much for your time.
Awesome. Thank you so much, Megan, for your wonderful presentation. We will now take a few minutes to address any questions that have come in. Throughout this presentation, please, we encourage you to submit your questions from both of our presentations today by entering them directly into the Q&A box, and I will read them to Carly and Megan to address. We also want to take this opportunity to encourage you to complete the evaluation for today's webinar, which will be emailed to you and should also pop up on your screen after you close out of today's webinar. Just a reminder that those evaluations are really important for us to continue to improve the continuing education that we provide to you. So we would really appreciate if you would take a few minutes to complete it. And so again, please go ahead and submit any questions that you have for our presenters. We will get started with our first question. And this question is directed towards you, Carly. How will you fund your community health worker once the grant is over?
Thank you, Chantrice. After the grant is completed, since our population is older adults who are mostly receiving Medicare, we will be working on implementing the chronic care management billing codes, and our registered nurse and CHW will work as a team with our nurse providing billing services and our CHW supporting her in the same way we've done our model in the past.
Excellent. Thank you so much, Carly. And I see we received a question, will participants receive a copy of these materials? Yes, absolutely. We will share the recording and a handout of today's presentation with all of those who registered for today's webinar. Thank you. And please, we'll take we have a couple more minutes for questions. So please use the Q&A box to submit your questions. And we'll give it another minute or two to see if any other questions come in. Great, we have another question. How many community health workers are employed in South Dakota? So Megan, do you want to take a stab at that question? And then we'll pass it to Larissa to answer.
Hi, Chantrice. I am not sure. There are 2 within SDSU Extension.
This is Larissa. I can add, we certainly know that this is a question that we get quite frequently, especially on these webinars. I think people are curious to know who is functioning as a CHW for many different reasons. I think it's one way that they can reach out to that organization who's employed them to kind of get a little more information about how they went about employing that person to begin doing CHW services within their organization. Unfortunately, the Department of Health has not set up a mechanism to track this profession, but I do foresee this definitely being something we will be able to do in the future as we continue to build infrastructure and support for this profession in our state. And so although we don't have a way of tracking it now, as I just mentioned, in the future, it's our hope that we will be able to set up some type of a database that will help us get a better understanding and be able to locate more of these folks and really utilize it as a way to share resources with these individuals and have the ability for other organizations to network with these people. So more to come on that, and I apologize that we don't have a way to do it right now, but we are very hopeful.
Excellent. Thank you so much, Larissa and Megan, for answering that question. We give a couple more minutes we have for questions. So if you have any other questions for our presenters for today, please take this opportunity to enter them into the Q&A box. Okay. Larissa, I'm going to go ahead and pass it to you. And if any other questions come up before you finish your presentation, I will pass it to you.
All right, thank you, Chantrice. In closing, I'd like to thank you all for joining us on this webinar today and for your interest in learning more about how community health workers can improve program outcomes in our state. And thank you all for the work that you do to help keep our South Dakota residents healthy. If you'd like to find out more about the work we are doing in regards to CHWs, if you're interested in joining the Cardiovascular Collaborative or would like to discuss potential opportunities to partner on CHWs, please go ahead and contact me using the information that I have listed here. And again, thank you so much for joining us today, and certainly hope you all are well, and take care.